Hello and welcome to New Prague Area Schools Open Enrollment for July 1st, 2020. Our open enrollment will run May 4th through May 22nd. That's the time frame you have to make any changes to your plans that you choose to make. Nothing is changing on our medical plans for July 1 of 2020. Everything will remain the same. You will continue to have our partnership with Medica, no changes to the plans. You have the option to enroll in 3 plans with the Open Access Network, and if you enroll in the VEBA plan network, the VEBA plan, then you have lower cost network options as well as defined on this slide. We'll be talking about those in future slides. Dental, nothing is changing. We'll continue with Health Partners, and we will also continue our relationship with Further as it relates to our flex spending accounts and our VEBAs. In order to participate in flex spending, either the daycare or dependent care or the medical flex spending account, you must enroll every year. It's not a benefit that carries over from year to year, so it's important that you take action if you want to participate in either of the flex spending accounts starting July 1st. You can log in with your username and password to access your account information under the Hello Further website, and make sure that you take a look at your debit card that you have received from Further if you have a Flex or a VEBA account. Those are issued with a 3-year expiration date, and if yours is expiring or soon to expire, you will automatically get a new card if you're still enrolled in VEBA or if you enroll in the Flex spending for July 1. So I encourage you to watch your mail carefully in June. Those cards do come in a more nondescript envelope, and I wouldn't want you to just throw it away thinking it's junk mail. This is a summary of the 3 plan designs that you have available to you. You have your copay plan, the $750 deductible plan, and then of course the VEBA plan. All 3 plans can be run on the Passport or Open Access Network with Medica, and then the VEBA plan has other network options that we will view here shortly. The deductible is the amount of money that you have to pay before the plan will kick in and assist with claims on some or most services depending on the plan. You will see that the copay plan does not have a deductible. If you have a catastrophic year, you have a chronic health condition, you probably want to focus on that out-of-pocket maximum. What is it going to cost you if, in fact, you have a catastrophic year or a chronic health condition? You can see that there's a cost per person covered on the plan and a cost per family contract. So let me give you an example. I'm going to enroll in the $750 deductible plan, and I'm going to have a family of 4. I am going to have a terrible illness in the plan year, and I incur $100,000 worth of claims. I know that of that $100,000, I'm going to have to pay the first $750. That's my personal deductible for most services. I still will have my prescription drug copays at first dollar. And then the plan will kick in, start paying 75%, 75%, and I'll pay 25%. Until I reach my personal out-of-pocket maximum of $1,200. So of my $100,000 worth of claims, I'm going to be responsible for $1,200. That $1,200 includes my deductible amount, my 25% coinsurance amount, and anytime I have a prescription drug that I pick up at the pharmacy. Now, the rest of my family may have their own expenses, which will be processed against their personal deductible and out-of-pocket maximum. But as we process our own, it will accumulate in the family bucket as well. So if you have a family contract with all members in your family will not exceed $2,400 on that plan as it relates to being out-of-pocket, as long as you're accessing care from the in-network providers. One member of the family on any of the plans cannot reach that family maximum. Every family member has their own personal, and then together it accumulates in the family. Preventive care on all plans covered at 100%. We want you to have your annual well child visits, annual physicals, your age-appropriate cancer screenings, immunizations, flu shots, all those things we do proactively to maintain good health, and you have first dollar coverage on that. On your deductible plans, you do not satisfy the deductible before you have that coverage. You can see on the VEBA plans, all VEBA plans, your deductible and your out-of-pocket maximum match. So once you have satisfied your deductible, you have 100% coverage for all services beyond that. All other services on the VEBA plans are subject to the deductible with the exception of preventive care. So if I go in for an office visit, I go to the pharmacy, whatever the case may be, I am going to pay that first $1,200. That's my risk for being on the plan, and then I have 100% coverage for the remainder of the plan year. So the Passport Network is the largest network that Medica offers, and it's offered on all three of our benefit designs. That network is no referrals. You don't have to identify a primary care doctor. You can just call a specialist if you want to see a specialist. All of those pieces are part of being in the open access network. You can also see that if you enroll in the VEBA plan and you don't want the open access network, you can choose a narrower network, and we offer 4 of them. We'll be going through those here shortly. If you enroll in the VEBA plan, you also get a contribution monthly into your VEBA account. Those dollars are your dollars once they're funded, and you have the capability of using those dollars against any medical, dental, or vision expenses that are not covered by health insurance or not covered on the plan because you haven't satisfied your deductible yet. So if I'm on that deductible plan and on that VEBA plan and my $1,200 deductible, if I've had $1,200 deposited into my VEBA account, I can use those dollars to satisfy the deductible in a future year. Medica Elect is one of the networks that you have available with your VEBA plan. You can see on the right-hand side of the slide there are 9 care systems. You have to identify with one of the care systems, and you need to stay within that care system. You can't go outside or it would be covered out of network. You can get referrals out of network if your doctor will give them to you. But let me give you an example. I am diagnosed with cancer, and I am with the Allina Medical Clinics, and I want to go to Mayo to see an oncologist. The Allina doctor is not going to give me a referral, most likely not going to give me a referral to go to Mayo because they have oncologists within their medical care system. And so I'm not going to get that referral. However, if I were diagnosed with a very rare condition and they would not have a doctor to treat that rare condition, and the doctor that would treat that is at Mayo, then I may get a referral to Mayo. But these smaller networks are pretty tight networks, and if you decide to go into one of them, then you are in that network for the full year. Vantage Plus is very similar to Elect, except that it's only the Fairview, Health East, and North Memorial clinics. On this, you can go to any Fairview, Health East, or North Memorial without having to call Medica and saying that you want to switch your care system. So it's available to you through the Vantage Plus. Park Nicollet is just that. It's the Park Nicollet clinics. You would stay within that care system if you enrolled in this particular network, and you would not be able to go outside the care system unless for some reason your Park Nicollet physician did give you a referral outside. And then RIDGEVIEW is the same. RIDGEVIEW's community network is just that. If you enroll in that plan, then you get your care from the RIDGEVIEW community network. The VEBA contribution, the annual contribution, if you're enrolled in any of the VEBA plans, you get $1,200 if you enroll in single coverage and $2,400 if you enroll in family coverage. And that is funded per month. The money has to be in the account in order for you to use it for reimbursement. So if I were to enroll in the VEBA for the first time, July 1st, and I had a claim in August for $400, there's a good chance if I have single coverage, I only have $200 in my account, I can use the $200, and then I would be able to reimburse myself for the additional $200 as my account is funded. You can list a beneficiary for your VEBA dollars in the event of your death. If you list your surviving spouse or eligible dependent children, then the account would roll to them and they would have access to that account just as if they owned it. So there would be no tax paid on that. But if you listed anyone else, your favorite nephew or your next door neighbor, then the dollars would be paid out to that particular beneficiary and it would be a taxable event. They would have to show the dollars that were paid out on their income taxes and pay taxes on those dollars. So the VEBA works like this. Your plan is a $1,200 single, $2,400 family deductible. Once you've satisfied your deductible, you have 100% coverage. All services are subject to the deductible with the exception of your preventive care. You can see that that's outside. You have 100% coverage right from the beginning of the plan year. And New Prague is going to put either $1,200 or $2,400, depending on your coverage tier, into your account, but it will be funded monthly, and then you can use that $1,200 or $2,400 for expenses that you and your family incur. All amounts in your account at the end of the plan year roll over to the next plan year. Those dollars never go back to the district. They don't go away. So if I've been on this plan for a few years and I haven't had to use it, maybe I've got $4,000 in my account. Starting July 1st, that's $4,000 is there and subject to accumulate more over the course of the next year as New Prague funds that amount. In order to use your VEBA dollars for your dependents must be covered under a group health plan. This applies to you if you are going to use your dollars for your spouse or dependents that are not covered on New Prague, but are covered on someone else's employer's group health plan. For instance, your spouse's group health plan, or maybe you have a dependent that is working and has coverage through their own insurance. You would have to submit a form that says they have coverage so that you can continue to use your VEBA dollars for those particular dependents. Now, if you're covering your dependents on your health plan with New Prague, then this is not a worry for you. You don't have to worry about it. When I say group health plan, that means it's an employer's group health plan. If you have dependents that are covered on MNsure or Minnesota Care or Medicare and not covered on your plan, you cannot be reimbursed for their expenses on your VEBA due to the IRS regulations. I always like to talk about how you access care can certainly affect what the cost is out of your pocket and what the cost is to the plan. New Prague is self-funded, and so we do pay all of the claims. So whenever you can save yourself and the plan money, you're saving yourself in the long run money as it relates to increases at renewal time. There has been a lot of talk with the COVID pandemic about telemedicine. We have two options for telemedicine that you can use with Medica. We have Amwell, and then we also have Virtual. As a disclaimer, I would say that a lot of the clinics now have their own telemedicine as well. So maybe you have maybe you're in with the RIDGEVIEW clinic system, and they have their own telemedicine where you can call in and talk face-to-face with a doctor. That would be covered at a lesser cost than if you were actually to go in for an office visit. Amwell is a face-to-face visit. You download the app to your phone or your computer, and you talk face-to-face with a doctor. That doctor will listen to your symptoms, come up with a diagnosis and a treatment plan. If the treatment plan includes a prescription drug, they will call that into the pharmacy that you've chosen as your preferred pharmacy. The actual cost for a 15-minute visit with Amwell, and I will tell you that 99% of the visits are under 15 minutes, is $59. Virtuell is where you go onto virtuell.com and start the process by filling out a questionnaire about your symptoms, including your preferred pharmacy, and then you submit it to Virtuell. There's a nurse practitioner at Virtuell that will take a look at your symptoms, come up with a diagnosis, treatment plan, and again, we'll call that into your pharmacy if in fact you need a prescription. All of this is done at a lesser cost for common conditions that you have not had to leave your home or school in order to participate in. Retail clinics would be the clinics that are in retail spaces like the Target clinic, the Minute clinics, and CVS, those types of clinics that you can access. And the average cost for a retail clinic visit is $100. And then it goes all the way up to the emergency room. If I had a sinus infection in Minnesota, these are Minnesota prices, and went to an emergency room, the cost for my care would be $750, whereas the cost for my care at Virtuell would be $49. Now, if you are on the deductible plan, the copay plan, your cost is certainly going to be less because you have copays for these situations, but again, it's going to cost the plan more. So just a little tip as to how you access care can save you money. Medica has a lot of value adds. I encourage everyone to have a mymedica.com username and password so that you can get access to your personal resource. This is where you can see how claims are being processed. You can access cost calculators. All of your explanation of benefits or EOBs are housed out there if you need to print one off for documentation for your VEBA or your flex spending account. And all your plan documents are out there. It's a great resource for you because it's just all about you. We will continue to offer the health club reimbursement. If you work out at a participating gym at least 12 days a month, you get a $20 credit on your gym membership. You register for that with your health club. You would need your Medica ID card and fill out probably a one-page piece of paper at your health club, and then they will start sending files to Medica so that you can get your $20 a month when you practice your well-being at least 12 days a month. They also have a 24/7 nurse line, and they have some healthy savings that are available. They do have a pharmacy application, and then they have the Live and Work Well. This is for you if you are having some issues with mental or behavioral health. It will give you help and support. It's confidential. Your access code is Medica, and it will get you online with some assistance to get you through your issues that you are experiencing at the time. You can also participate in their well-being program, My Health Rewards. This changed January 1st a little bit because Medica did partner with Virgin Pulse. Virgin Pulse is the largest national well-being provider that there is, and the program runs on the calendar year. Anyone that's 18 years or older covered on the plan can earn up to $100 in gift cards each year. So you can either register through the free Virgin Pulse app, and the directions are here. You click Create Account, search for Medica, and then select Medica My Health Rewards and complete your registration. Or you can register online at medica.com/myhealthrewards in order to participate. You can do some journeys. You can track your fitness, and the tracking devices are a lot more than they used to be, so you can even use an Apple Watch now at this point in time. And you can start earning points, and your points can turn into gift cards for you. There are 4 levels of points that you can earn. So once you earn 2,000 points, you get a $10 gift card. If you earn 10,000, you get a $20, so on and so forth. Your gift cards, you can actually take, there are 15 merchants, including Amazon and Visa, if you want the gift cards. If you want to donate your gift cards to a cause, you can do that, or you can spend the dollars at the Virgin Pulse store for well-being types of products. If you have any questions of Medica or any My Health Rewards or anything having to do with Medica, their customer service is available Monday through Friday from 7 a.m. to 8 p.m. and again on Saturday from 9 to 3. We also give you an employee assistance program. I always say the EAP is the number you call when you don't know who to call. It is absolutely confidential. We never get any files or reports on the EAP usage, and so be secure in knowing that it's a confidential service for you and a valuable service. It's available 24/7 by phone. They also have a resource library. You can use it, your spouse can use it, and your dependents can use it. There's no charge to you. You can have up to 3 face-to-face visits per issue per year with a mental health counselor, and you can have up to 6 sessions a year if you want some assessment or brief counseling. We find that the program is most used for financial, legal, childcare, relationship issues, stress. A lot of stress calls, especially within this COVID pandemic that we're in. The EAP utilization nationally has increased because of the pandemic. These are the deductions after July 1st that will be coming out of your paycheck based on the plan that you're enrolled in and the coverage tier that you're enrolled in. So at the top of the slide, it's the single, and the bottom of the slide, it's family, and what will be coming out of your paycheck per pay period. This is principals, transportation, clerical, and nutrition services. I'm just leaving the slide up for a little bit in case you want to take a picture of it. The next slide is custodial, support staff, teachers, and technicians. You can see what your costs are depending on the plan and the coverage tier. And the last slide is the Band D and Band E employees and what your contributions are for medical. Dental, as I said, nothing is changing. We still will have our partnership with Health Partners. You get $1,000 a year to spend on your dental expenses, and that's whatever the insurance pays is what accumulates to that $1,000. That would include your preventive care. If I go in for my 6-month checkup and the actual visit after contract discounts is $80, the insurance pays the $80 and it counts toward my annual maximum. We also do allow $500 per calendar year in implant coverage payment, and that too accumulates in the thousands. So if you have an implant, the $500 would count toward that annual maximum, and you would have $500 left to spend. You will see that the benefit is exactly the same, whether you go in-network or out-of-network. However, the out-of-network benefit, those dentists do not have a contract with Health Partners, so they would charge you whatever their retail cost is. You would have to pay any difference between what the plan pays and what you pay. And so it would, in almost all cases, cost you more money to seek care from providers that are out of network. And here are the deductions per pay period for dental. The Flex and VEBA administration, formerly Select account, is our administrator. The flexible spending account for medical is a personal account that you determine what's going to go in. You come up with your predictable expenses, and then you determine what you are going to take out of your salary pre-tax. If you were to do the total $27.50 that's allowed, or any dollar amount, payroll is going to take that annual election that you make, divide it by your paychecks, and then the money will come out of your paycheck on a pre-tax basis. But you have access to the full amount from the first of the plan year. So if I were going to do LASIK eye surgery and I decided that I was going to flex $2,000, payroll would take the $2,000, divide it amongst my payroll, my paychecks. However, if I wanted to have my surgery or I scheduled my surgery for July 23rd, I would have access to the full $2,000. I could pay the provider the full $2,000. I've made a promise to pay over the course of the year out of my paycheck, but the money is available right away. Unlike the VEBA money, that money is available as it's funded. You have 4-month run out to submit your claims, and we also have a grace period on this plan. It's a 2.5-month grace period, so it's June 30th, and I still have $500 left in my account for my medical flex. I have submitted all the claims that I incurred during the plan year from July 1/19 through June 30th of 2020. I can incur claims for the next 2.5 months through September 15th and have access to those old dollars. And then at the end of the plan year, at the end of my 4-month run out, whatever is in there, I'm going to forfeit because these accounts are use it or lose it. You have access to your dollars, instant access with the debit card, and eligible expenses would be medical, dental, and vision for yourself, your spouse, and your dependent children. If you are enrolled in an HSA account under your spouse, then we would advise that you enroll in a limited purpose flexible spending account with us because that would give you access to your dental and vision. If you enrolled in the full traditional, your spouse would not be able to fund their HSA. Dependent care or daycare is the other program that you have available through Flex Spending. You can put up to $5,000 per calendar year, take that out of your paycheck, and then be reimbursed for dependent expenses for your children that are age 13 and under, or dependents that are incapable of self-care that are older than that. The $5,000 comes out of your paycheck in increments, and in this case, the money is available to you as it comes out of your paycheck. So if you do the full $5,000 and $210 comes out per paycheck, you have $210 to be reimbursed. It's not like the medical flex where the full amount is available at the first of the plan year. Your VEBA is a tax-free healthcare savings plan as well. It's always funded by the employer. You cannot put money into this account. You can use your VEBA account for medical, dental, vision expenses for yourself and your family if your family is covered by a group health plan. And you can also use the dollars if you were to terminate your employment and use the dollars for COBRA premiums or Medicare premiums when you are transitioning between after retirement. It's important for you to know that these dollars roll from year to year as well, and these dollars don't go away. Once they are in your account, they are your dollars to spend on the eligible expenses that you have until the account is exhausted. You can also do investments with your VEBA. You do have some funds through Further that you can put your dollars into if you choose to. You can contact Further for more information about investments. And you would manage your account online. Remember, this is your account. You drive it. You can use the dollars or save them for future use. They're not going to go away. They can never go back to the district. You do have, or Further does have a mobile site and a smartphone app if you choose to do that. And they, of course, have customer service as well, Monday through Friday, 7 to 8. So, only employees newly enrolled or changing plans or networks or tiers need to complete a Medica enrollment form. If you're happy with what you have, you don't have to make any changes. You don't have to do anything for open enrollment. If you waive the medical coverage with New Prague, we require a waiver form be completed every year. So if you are waiving medical because you have coverage elsewhere, please make sure you submit that waiver form. And only employees newly enrolling or changing tiers need to complete the dental enrollment form. Our annual enrollment is for the medical and dependent care flex. You must enroll in that if you want to take part. And everything has to be done by end of day Friday, May 22nd, in order for you to have the changes that you want July 1st. Have a great day.